My name is Elizabeth Adaugram. I'm AP student. As I do practical about past 8, my 4-week practical, I do skill about demonstrated recovery position. As practical instruction to watch videos on YouTube, I watch video and read about past 8 acquired recovery position. And this skill is safety for demonstration. As a first aid doctor, you need to check the person and keep airway opening and prevent shocking. So another way, you need to see how person is responding and how that person is listening or feeling. So when you are just taking care for unconscious but breathing person, so you need also to touch the shoulder to see how person is feeling. While you are shaking that person, you can also spring the water on the person, so you can see how that person is responding when you spring the water on the unconscious but breathing. So another way, you can see how sent that person is and you are just calling for help. When you are calling for help and you are a first aid doctor, you need to monitoring the person, how breathing is, and how and you to manage and you keep airway opening for that person. As a first aid doctor, you need first to check to make sure the person is responding or the person is just okay. Even if it is not fully okay, you need to make sure, and you can put your ears on the chest and you can touch the chest, how breathing is and how the person is feeling. So as a first aid doctor, those things you need to carry out. So, and you can make sure also that you are waiting for help and you need to carry out your some things. You give something to the person while you are just waiting for help. And monitoring also is important. So when someone is unconscious and breathing, you need to monitoring and keep airway opening